All right. Good evening. I call to order the Monday, September 14th special meeting of the River Falls Board of Education. This meeting has been properly notified. Do we have any visitors or delegations who would like to address the board? And I know that Ruth would. You may, if you could stand, please, and for the record, tell us your name.
My name is Ruth Wood, and I'm here as representative from the Pierce County Board. I'm the supervisor for District 4, and I'm also the chair of the Board of Health. And that's kind of my capacity for being here right now, because one of the decisions we made as a Board of Health is to do everything that we can to support our public health department, which, as you may realize, is under a little bit of stress right now. Not just because the workload gets harder and harder every day, but new things arise, new complications, and right now with the school year beginning, there are lots of phone calls coming in from parents who don't quite understand why their child has been quarantined or sent home to stay for a couple of weeks. And so what I have here to hand out to you is just a list of things that are going on, things that are being done, and kind of some explanations, some legal guidelines, some explanations for why things are going the way they are. Because one of the things we learned in terms of supporting an agency is that knowledge is one of the best things. And so if any of the information that's on here is useful for you to pass on to any parents, teachers, or students that you deal with who doesn't understand why something has to happen, feel free to pass it on. So I'm not going to go through this whole thing, but I think paragraph 2 that starts, simply put, testing, tracing, isolation, and quarantine are the best strategies to us to avert the crisis in the absence of pharmaceutical intervention. And I think we all realize that. You need to wear masks, you need to use your hand sanitizer, and you need to do whatever you can in terms of social distancing, in terms of not contact, being careful of where you go and so forth and so on. And that really is our best defense. It's the mechanism. I mean, mainly that's the main mechanism that we have. It's just to make sure that we do whatever we can individually to stay away. So school becomes a very difficult place for that to happen, because you have people who want to be together, and of course you want to discuss, you want to move around the classroom, you want to have activity. People have to come on buses, have to go to cafeterias, we have all those things, so it's really, really hard. And I appreciate all the efforts that have gone into the programs that you've developed for the year. and I hope for your sakes that things just work out as well as they possibly can. But it's tough. It's tough. And we all have to recognize that it's tough. And so all of these other things that we do, the issue of contact tracing, your schools are doing it. You have nurses hired and agents hired to do contact tracing, which is helping out tremendously for the Board of Health, because the amount of contact tracing that they already have to do is huge. So they have help from the schools is important. I've circled dot number 3 on this. Extremely important that parents monitor their children for symptoms and keep them home. I don't know how much you're emphasizing that, but this is really, really an important thing. And hard, of course. Parents have had their kids around for months now, and the idea of getting them in school is a really happy idea. But that's a tough one. If anytime they're symptomatic at all, they should be staying home, because as you know from statistics, every person is likely to infect 2 or 3 others. So if you get 2 or 3 others in a class of 20 infected, then that just multiplies like that. So parents need to understand this too, and I don't know I don't know specifically what you've done, but if there's any other information or nudging that could be made in the schools to make sure that parents understand how important it is to keep kids home. And I think for the same thing, parents need to know how many children and adults are in close contact. I'm not sure parents understand this because some of the calls we get at the health department are from parents who say, why should my kid have to stay home? You know, the classroom is distance, et cetera, et cetera. And I think parents maybe really don't understand what situations are. So I think passing that on to teachers and administrators is also good. One specific thing, this is third one from the bottom. The quarantine cannot be shortened. And I think this is an issue that's hard for a lot of people to understand. You know, they have their kids tested, the test comes back negative, and they say, shouldn't my kid be back in school? But if the test was made before a 14-day period is up, you still don't know because the kid could come in. So I think that's an important thing to emphasize. Yeah, I don't want to go through all this, but you know, the bottom line, I'm a teacher too. I spent my life in public schools, and I actually was privileged to be in this school a few times because my last job was as the English education prof at the university. And so, and I supervised students in schools because I had 15 years of experience in public schools, middle school and high school. And I did that because I love school. I always looked forward to being in school when I was a kid. I understand how important schools are. And I want us all to just get behind this so that we can keep our kids in school and do whatever we can to make it a safe, comfortable place. But the other thing that all this hinges on, which is, I can't find where I have it on here, the tipping point. You know, one of the reasons that we have to just keep this in check as much as we can is that the public health department is a limited resource. Our hospitals and care centers are limited resources. And if we let this get pushed beyond a critical moment, then we don't have the healthcare functioning to keep it in check. So we've got to just keep doing the best that we can to keep it as tightly under control as we can, but still not losing our education. And all that I want to say is that I would appreciate all the support and encouragement you can give to the public health department because they are doing monumental work at this point. And I'm proud to be a part of that because we really have an exceptional public health department here. And whatever support you can give them, we'll appreciate. Thank you. If you have any questions?
Well, thank you very much for coming, Ruth. One of the things that I'd like to pass on to you is that we have been very impressed and pleased with the level of expertise and support that we have received from A.D. Snyder in particular. She has been a wealth of knowledge. She has been supportive, and she answers a lot of telephone calls from our superintendent. So we have had very nice collaboration.
Yeah, she is an amazing person. I don't know if I think it was in the paper, but she's not 40 years old. I mean, she might be now. I don't think so. I think, no, she's still not even mid-30s. And she was picked in the first round of an award that was developed a year and a half ago for outstanding health directors across the nation. They picked 40 from across the nation, and they called it 40 under 40, and she was one of those. I was on the board during her hiring, so I was there when she was interviewed, and I mean, she could blow you away in an interview. She'd been working in Baltimore, and we asked her questions about Wisconsin statutes. She knew everything. I mean, she didn't look at her notes. She knew everything. She absorbs knowledge like a sponge. And she's a very detail-oriented person. She's not sloppy about anything. And she's just, I think she's really, masterful. We are really, really lucky.
Well, from that standpoint, then she also becomes a role model for our girls, for our students here in terms of growing up to be a woman in science. So we appreciate her.
Yeah.
Although there is always more communication that can happen, I believe that our district administrators, our principals and so forth have really done a good job of communicating with our families about our expectations regarding monitoring, about the flow chart that I believe came, that we came from you, that we focus on in terms of when students need to be excluded and so forth. So I'm confident that they're going to keep up that good work.
Yeah, I know. AZ talked a lot about what a good rapport you had. So planning the way that you're going to do the school year. So
well, and we
kudos to you too for that.
So thank you for being here.
Yeah. It's nice to be here.
And I know that you have another meeting that you would like to attend, and so I just want to tell you it's not rude for you to leave unless you want to stay and keep us company.
I might just linger in the back.
Okay, that's just fine, Thank you.
Thank you so much.
Sure. Do we have any other visitors? All right, we're going to move into informational items, and as every Monday, we then turn to our Wildcat Roadmap for any potential updates.
No other updates beyond. Later on the agenda, the board will be asked to approve a policy related to face coverings, masks. We are going to add that to our dress code under the advice of legal counsel. But that then segues me into this next item on the agenda. There is no recommendation for us to change learning environment, but as we developed the habit over the last couple of board meetings, we will continue to always give the board this update regarding our regional statistics and our local numbers related to COVID. This is a snapshot as of today. And once again, so first is the reminder that, again, AZ Snyder has mentioned to us in the past that there's a couple of really important numbers to keep in mind that would affect the need for us to close. This is not none of these are standalone items. There is no number one. There is no single statistic, no single data point that is going to cause us to either shift to everybody being at home learning or to bring everybody back. But just a couple of notables here is that burden, it's a 2-week number that we look at, and the inability for the department to do their contact tracing. A couple of other quick indicators here. So again, for us, we're at 91.3 with that burden rate. Public health is able to keep track of and monitor newly identified cases and those that have been within close contact. So the overall public health capacity with health services and clinics and hospitals and so on still continues to remain in check as well. I'm not going to open those dashboards. I leave this slide on here just as a reference if people wanted to look. The Pierce County and Sauk County dashboard is where we obtain most of our information from. This slide shows the Pierce County number of new cases, new confirmed and probables by week. So again, we're showing the past few weeks, this week at 27. And for the number of active confirmed and probable cases by week here, you can see where we're at with this last week's number of 46. St. Croix County, again, dashboards appear differently. They're not the same dashboard for each county. Number of active cases is 112. If we're in search of any amount of good news, not that 112 active cases is anything to brag about, but notable is that this number has been higher in the past. I think you could see in that early July range when numbers were repeatedly quite high that those numbers here, this active total cases was in the 150, 160 range. This is the Minnesota model. Disclaimer as always, it's not the lone determining factor, but it's something interesting to look at. It's a formula of sorts. So when you punch in our numbers here of the 14-day county for Pierce and the 14-day count case rate for St. Croix, and you do the math on that, it would put us in this Minnesota model. I put the dotted line here at 9.13, 9.4 for the two counties. Puts us right on that line, obviously, which we remain in the in-person learning for elementary and the hybrid for the secondary levels. I added these two slides not to confuse, not to add mud to the water. Just another illustration that there's a number of different factors to look at. And as we all learn more, one thing that AZ and others have pointed out to us is that the positivity rate for the number of people that are tested versus those that test positive begins to climb, you're in trouble. And this is an okay number. Again, strange choice of words probably to say okay when we're talking about any amount of positivity. I don't have a magic number to say. I have heard, I believe that when you get into the 8%, 8, 9, 10% range, you're definitely heading in the wrong direction. So I just thought I'd point that out. This is Pierce County. This is St. Croix. Similar number, 4.9. And then our district status report on where we're at. Staff absences, there are 3 pending test results, 4 pending test results of a household member. Student absences, 27 students are out due to COVID symptoms. 22 are out due to household members having symptoms or waiting their test results. 11 are out due to being in close contact. And we're going to start to we don't want to narrow this down and say 1 student or 2 students. So we're going to be careful so that it doesn't provide an opportunity for people to perhaps isolate or single out or to identify the student in which we might be referring. And so we're talking in general terms here. We're still at less than 5 students that have tested positive and have returned to school. So that's it. Those are the quick slides. Again, just added those 2. Otherwise, same kind of report I've provided the last 2 or 3 weeks.
That last line, 5 students tested positive and have returned to school. Does that mean there's more that haven't returned to school?
No.
So that's the total number that's actually tested positive and they've all had enough time to return to school. Yeah. Okay.
Yeah, that's notable too. Again, we suspect it will
Yeah.
happen,
Yeah.
but none who have tested positive were first at school.
Yeah.
And then are now at home testing positive.
Can I ask about any of the other districts in the area? Just what experiences they might have shared?
Prescott has had a couple of cases. I know that they are now shifting to some form of a hybrid model. I don't know for sure if I assume it'll be similar to ours, but they were back.
They were
All students were back.
Okay.
And because of a few cases, they're going to back off now and do a hybrid. I know there was in Spring Valley a couple of cases as well with some employees. The rest of the districts, I guess those are the only 2 that stand out in my mind as far as hearing any kind of information related to where they're at.
Sure.
AZ told me that there was some in Ellsworth. I don't
Okay,
Any questions about the update for today? All right, then we are going to move on to action item letter B. This regards the memorandum of understanding between the school district and specifically the Montessori and UWRF. So Nathan?
this
And maybe
memorandum, Nathan will explain it in greater detail, but in a nutshell, this has much to do with the UWRF likes to use our Montessori classrooms largely due to the fact that we have manipulatives and materials and resources that allow the training of those university students to experience the classroom setting. But Nathan, you can elaborate.
Yeah, so starting back, I think it was 2000, Linda Jacobson is also here from the university, and she's whom I've been working with for the past 8 years now. So back in 2012, we started this partnership. As Jenny said, the draw for the university for us is that we have rooms full of materials. It can cost upwards to $20,000 or more to outfit a classroom. So we partnered with them over the years, and the memorandum of understanding has stayed the same, more or less, over the years. This year, there are a couple of additions due to COVID. So those are 1.13, 1.14, and 2.8. And they just, what those are just kind of what we use as a district in terms of doing COVID mitigation, and then what the university has used too. So also attached to the packet tonight was the Falcons Reward forward document, and going through this and ours, there's just quite a bit of overlap. And the idea is that if there were a case where they didn't line up, we would do the more cautious approach to it. So also to note would be that the idea that, because they're two different entities, and so really the only time the university would not use the building would be if both the university was virtual and the district was virtual. So every other case, we'd allow the university to use that. Even if we are virtual, they would still use our building. Part of that was due to the idea that their class sizes would be below, I think they're below 10. So in terms of number of occupancy within inside the building, we'd be well below that. There's plenty of space to social distance.
Can I just make one comment on, if you look at item number 4 on those options, we would still like our faculty to be able to use the classrooms because that's where all the users are. And it's hard to teach, for example, Montessori math when you don't have any of the materials to teach it. The teachers don't have them at home, the instructors don't have them at home. So it would just be an instructor that would be in the classroom in those cases, but no students. So that's just one clarification I want to make.
Thank you.
So that's on the bottom of page 5, the bottom
Yep.
part of the grid on page 5.
Yep, number 4.
Mm-hmm.
So Nate, seems to me there's a couple things we're considering here tonight. One is we approve this periodically, our
Yeah, I
memorandum
think
of
we're on
understanding.
a 2-year cycle,
Yeah, okay.
and this is just a 1 year due to the.
So that's part of it, but we're updating it. But what this means is, to me, so when I'm reading this, not that we wouldn't want the university involved in this because they've been integral to the success of our Montessori program and everything. But the reality is that we will have college students and faculty in our buildings. Do we allow anyone else in our buildings other than faculty, staff, and students?
I do it during the school year, the student teachers. I know the Greenwood has an arrangement with, I think, the psych department or counseling departments. They come in.
I mean, currently with the guidelines with
Yeah.
COVID.
Yep, those.
Okay, so we will have student teachers in our buildings too. Okay.
Yes.
Because I think that's, I'm not objecting to that. That's just something I hadn't thought about when we were deciding on the hybrid and the face-to-face is just how many other people are going to be in the building that we aren't responsible for because we're keeping out. Are we allowing parents in the buildings?
No, we don't have volunteers. Off the top of my head, I can think of no other exceptions than the one in which you're talking about right now. You know, UPS, FedEx, people come in and out, but we've said that unfortunately, we have to be very restricted.
Right.
In volunteers and parent visits, grandparents coming for lunch and visiting with kids, and that we're not doing any of that. On this issue, here tonight, as well as the topic of university student teachers, you know, we obviously had to hold that debate over whether or not the risk associated was worth the reward of continuing to advance trained professionals in the field of education. And so we do continue. I, off the top of my head, cannot tell you the number of students that we have, university students involved in our district. It is a fairly small number, I will say, but unfortunately, I don't have the number off the top of my head. I don't know, Kit or Mark.
It's less than 10, I think, district-wide.
So how confident, I'll look at you, building administrators, how confident are you that we can control those groups, control, I put that in quotes.
Right, so,
I'm asking this hypothetically, but I just
Yeah,
think we
yeah,
ought to,
that's-
as a
that's
board,
fair.
talk about this.
so, a couple things to mention, that these classes are on the weekends. And so there are no students in the building, and then we're following the cleaning procedures that we would use, just on a daily basis. So the university is provided with all the cleaning material, spraying the hard surface, wiping down the materials they use, and those be sitting. And then starting that Monday, then our custodial staff is in there doing their deep cleans that they usually do. So there's actually there's no overlap between the university students being in the space and our students. It's all weekend based.
Because I just think, as we think through this, where we may have someone say, well, I can't be in the building, but you're letting students into the building. But we've got an arrangement, and I think you've laid it out here nicely, that they're under some restrictions before they come in.
They'll be restricted to the rooms that they're assigned. They will have access to the teacher's lounge to put their food in the fridge, but other than that, they're stuck to the spaces that they're assigned.
And we really can't think of any other groups that we might be allowing to do this.
No, the other thing is that if somebody says, well, I can't be in the building, but you're allowing the universities, it's apples and oranges because they're there when nobody else is there.
Right.
And it's for educational purposes,
There's no
which is
overlap.
very different
Yeah.
from, I'd like to have, I don't know,
Exactly.
some other event that is not connected to our mission,
Right.
so.
But we will have student teachers in the high school, in the middle school? Okay, so they will be there during class time, not on the weekends. Okay. All right. So I just so we're aware of that. So if we're asked about that,
Yeah, well, that's good.
we're okay with that. And with a degree of confidence, I think we've got to figure out, because we got all kinds of people coming and going. Our staff are coming and going, and our students are coming and going. Obviously, it's just a matter of how many people will we make exceptions for. This seems to be a reasonable one to me, that we would allow student teachers in our buildings with these kinds of restrictions, and especially with Montessori, where we've had a long-standing relationship. They get it and they understand that building. So, okay.
Adam, just to add to that, just additionally, there's been a lot of conversations with the education department over at the university, and they recognize the ask in having student teachers here. We as an administrative team did have discussions regarding wanting to support the preparation for teachers, through that pipeline and giving them experiences. We are looking at other virtual options for just field experience placements versus, having them in the classroom. There was a lot of conversation about that as well. But the university, I have to give them kudos, because they have put into place a lot of expectations for their teacher candidates, knowing that they are coming out in an environment that is a tough ask for school districts as well. So even with an extension of this memo, looking at our guidelines, looking at their guidelines, I have to commend the university for, no, we can't make any guarantees, but they have really done a good job in trying to educate the teachers that are coming into the building with expectations while they're here on campus. So
They be expected to follow the
assuming you support their use on the weekends?
Yeah, it's been a growing experience over the years. I think that over the years we found ways to collaborate with the university on this. And so yeah, it's nice to have them as a partner.
Okay, at this point, do we have a motion to approve the annual memorandum of understanding between the school district of River Falls, the River Falls Public Montessori Elementary, and the University of Wisconsin River Falls?
So moved.
Thank you, Alan. Is there-
Second.
Thank you, Todd. Any further discussion? So Bob is not able to be here and his preference will not be recorded in the vote, but I do want to say that he has expressed his support for this motion. Any further discussion? All those in favor?
Aye.
Opposed? The motion is carried. Now we will turn to consideration and potential action to approve a first reading of a revised policy 443.1 related to student dress, and then, bye Linda, thanks for being here. The necessary revisions to make it parallel with the employee handbook. Dave, could you help us with this, please?
Sure. So the two documents are on the first reading of the policy 443.1. Ultimately, there's no suggestion to change anything that was with the original handbook, policy regarding student directors, adding the piece related to face masks and covering. So the first paragraph just kind of outlines who would be responsible for instituting that and the decision-making process that they would go through. So it's the superintendent or designee in consultation with the board has the authority to require face coverings or masks if deemed necessary for the health and safety of students, staff, and visitors. They will rely on guidelines and expectations outlined from the CDC, the Wisconsin Department of Health Services, and Pierce County Public Health. So ultimately, it won't just be the superintendent chatting with the board to make the decision that we'll rely on those guidelines, but this is clearly stating that if and when the statewide mandate expires, the district has the authority to keep that mandate in place as long as it deems necessary based on the guidance from local and state level authorities. And then everything below that is really just what's in the handbook, which is in the roadmap right now, that outlines what our expectations are for masks for everyone who's in the building. And it's really cut and paste language from the state mandate right now. So it defines what a face covering is. It defines the expectations for wearing the masks, and it outlines the exceptions of when a mask would not have to be worn. And so that is the first reading of the policy revision. And then in the handbook, that's the location that we would land for employees to outline those expectations for employees. And that is in the section that applies to all employees, and it's outlined there as well. Other questions?
David,
Alan?
so 4 or 5 years from now, when this year is just a distant, ugly nightmare in our memories, will we still have this
Yep.
in our handbook?
Unless we choose to revise it again and get rid of it, but
If
try to
someone-
write it in a way that allowed us that flexibility, so.
This superintendent would never, this superintendent would come to this board before we would assume that we're going to move away from wearing masks. I would ask the board to approve such a change.
But this would be this isn't just a temporary thing for now. This would be a
That's not the
permanent.
recommendation. The recommendation is to have it in policy to allow that.
Okay.
Judges would also center that judgment on guidance from local, state, and national recommendations.
So we've got something in place in case we encounter something like this. Okay.
Okay, at this point, do we have a motion? We could take these as one combined action. To approve the first reading of policy 443.1, student dress, with revisions to include the face covering masking requirements, as well as to approve the motions to the employee handbook to include face coverings, mask requirements. Is there a motion, please?
So moved.
Thank you, Todd. Is there a second? Thank you, Mike. Questions, comments, discussion? I think it's wise for us to do this. I think it makes sense. It makes our intentions very clear, and that's important. And it aligns us with a legal standing for why we are doing what we're doing. Anything else?
I appreciate you putting the definition of what a face mask is in there too. I think that was a good part of it.
I appreciated that it said that they needed to cover, and so they mouth and nose completely. So they have to fit properly, and they have to be effective masks. Again, we will not be recording Bob's preference, but he is in support of this change to policy. So, all those in favor? Aye. Opposed? The motion is carried. All right, do we have any proposed items for future meeting agenda? All right, then we are going to schedule the next meetings at least through September. The next regular board meeting will be Monday, September 21st at 6 o'clock. The annual meeting will be Monday, September 21st at 8 o'clock. And I point out to everybody, we have 2 hours. It's really important for us to be able to keep that annual meeting on schedule at 8 o'clock. So I know that we will have a full board meeting agenda, but we are going to need to be respectful of the time and move through it diligently and quickly. There will be a special Board of Education meeting on Monday, September 28th at 6 o'clock. And currently, the recommendation that Jamie has suggested and that I agree with is that at least for October, we continue our every Monday meetings. We can always make an adjustment if it seems plausible, but we will schedule those at the next meeting. And with that, anything else?
And as a part of holding regular Monday meetings, there will be additional items added to those agendas that typically would have fallen onto a committee, a personnel committee, an ed program committee, a finance committee, but we will basically meet as a committee of the whole and address those issues through the special board meeting process rather than holding committee meetings.
Which makes sense. Meeting is adjourned. Thank you, everybody.
Hey, Mark.
Maybe we're on to something.
Yeah. You guys get started?
Yes, the election.